Hi guys, welcome back to my channel. As some of you may know, my name is Ryan. I am a registered nurse working in the UK. I've worked as a nurse for about 5 years, and today I just wanted to talk a little bit about the stereotypes of being a male nurse. They've all never really bothered me, but I just wanted to go through a few of them. So the first one is the sexuality of a male nurse is assumed, or sometimes you may be deemed as a bit feminine, which, number one, so what? Doesn't really matter. Number two, there's a variety of male nurses, many different sexualities, and it has no effect on my life. However, that stereotype is now going away, which is great, what we need, because only 10% of the workforce is male, so we need more. If you guys like movies, you may have seen the movie called Old. It's a psychological thriller. I think it's amazing. If you haven't watched it, please watch it. I've not been sponsored or anything, but you know, it's good. So there's a male nurse in it. I feel like he's presented really, really well. He has a lot of empathy. He's friendly. He's approachable. He seems like he knows his stuff really well. And you know, that's what you want. That's what's happening now. The stereotypes in this social media is really promoting male nurses, which I think is fantastic. The next one is male nurses are failed doctors, which I would obviously disagree with. I've I wouldn't say nursing is something I've always wanted to do, but it's something that when I explored all the pathways in healthcare, it is something that really caught my eye, and I really wanted to do it ever since I had work experience. And you know, doctor didn't really appeal to me because you can't be with the patients as much, and it's not really my thing. I've also met some extremely clever nurses who, you know, have had A's in everything, and again, they just, you know, they wanted to be a nurse, and there's nothing wrong with that. And also there's different ways, as I've spoken about in other videos, where you can progress in nursing. You know, if you wanted to do, if you wanted to prescribe stuff, there's nurse practitioner courses. If you wanted to, you know, specialise in something, there's clinical nurse specialists. If you wanted to teach, there's lecturing. So there's all sorts of things that nursing can do. So another one is male nurses can climb the ranks more quickly, which is not correct. There's all sorts of men in different positions. So me personally, when I was a ward manager, I would review applications appropriately. It would not affect me about anyone's gender. If they turned up to the interview, no matter what gender they are, I would really look at how they're answering the interview questions and how would they fit into the role, and what kind of I would see the service like with them in. Gender has not played a part in it, certainly when I've been interviewing. Next one is male nurses lack empathy. This is incorrect. We have as much empathy as women do. You know, I cry. I'm not afraid to admit it, not ashamed. So, you know, if a patient's going through a difficult time, we're there for them. You know, we can put ourselves in their shoes, and you know, some of this stuff that patients are being diagnosed with is really, really bad, and you know, we're allowed to cry as well. We're allowed to go through this time with them. But on the flip side as well, if a patient's, you know, getting healthier, they've been stuck inside hospital for a while, we've also got that bit where we're also happy for them, and we are compassionate, and we do care about our patients. And I think that's really important to kind of say that male nurses do have a lot of empathy as well. All of these stereotypes have not affected my life as a nurse. These, you know, I've just kind of got on with my life. I have heard them here and there. I'm not going to say I haven't. I've had one, you know, comment from a patient in my 5 years of being qualified, 8 years including being a student. Just brushed it off. You know, I came out of uni with a good degree. You know, living the best life. I'm currently 26 years old, and I've got a practice development nurse role, which I'm loving. At 24 years old, I was a COVID ward manager. You know, I'm really enjoying my time as a nurse, and for anyone, I'd really recommend it. Thanks for watching. If you like this video, please give it a like down below. If you have any comments, I'm happy to answer them. Thanks guys, see you later.